talk to us this morning about children's health. And we'll begin by, let me introduce Meredith Justice to everyone, pediatric nurse practitioner. Good morning. Thank you for joining us.
Good morning, Scott. How are you doing?
I am well, thank you. Thank you for being on the program with me this morning. I appreciate it very much. And let's go next to, let's see, Dr. Shawna Young is also on the phone. Dr. Young, good morning to you.
Hi, good morning. How are you doing today?
I am well, thank you. And also Dr. David Hernandez is on the phone. Dr. Hernandez, good morning to you.
Good morning to you as well.
Thank you all for joining me this morning. We appreciate it very, very much. And so let's start to, I guess, at the beginning by talking a little bit about your backgrounds, everyone. And Meredith, Meredith Justice, pardon me, would you talk a little bit about your background and how you got to San Juan Health Partners Pediatrics? Let's start there.
Absolutely. I started by working in the hospital as a nurse in North Carolina, and then went back to school to become a nurse practitioner. Specialized in pediatric concussions for a couple years in Austin, Texas, and now I am here in Farmington and working in the primary care office and really enjoying it.
Very good. Well, and you've been there for how long?
About 2 years, just under 2 years.
Excellent. Well, welcome and great to have you on the program this morning. Let me ask the doctors the same question. I believe they're a bit newer to the community. Dr. Young, can we start with you and a little bit about your background, please?
Yeah, Scott. So I am from Albuquerque, New Mexico. Went to UNM for undergraduate and medical school. Was able to do my pediatric residency program up in Sioux Falls, South Dakota. So kind of a similar rural scenario.
Sure.
And so I think that was beneficial for getting me ready to come up to Farmington to practice. And I did start here, the group, about 4 or 5 months ago, and am enjoying the environment so far.
Very good. Well, welcome to you. And I know it's exciting to hear a New Mexico school doctor returning to practice in New Mexico. So thank you for doing that.
And I'll give a little shout out to my husband. He's also a UNM grad, and he's also a family medicine provider here in the community. So this is his hometown.
Excellent. Well, welcome and great to have you here. And let me ask Dr. Hernandez, same question, a little bit about your background, doctor. And I think you went to school here in New Mexico too, if I'm not mistaken.
That is absolutely right. Yeah, similar story. I actually grew up in southeast New Mexico, so near the Carlsbad area. Loving New Mexico, if anybody is familiar with that area. I also went to UNM for my undergraduate and medical school studies, and then I just completed my residency in Seattle over in Washington, where I was working at Seattle Children's Hospital as well as the University of Washington Hospital there. And I'm the newest member to the practice, so I've been back about 4 months with the practice. And yeah, just similarly, very happy to be back in the great state.
Wonderful. Well, we're glad to have all of you in New Mexico at San Juan Health Partners and on KSJE with me this morning. So thank you very much. But let's start talking about children's health. And I guess the big question would be, because everyone's certainly still talking about the pandemic and what we know about COVID-19 and how that affects children. And from all that I have heard, that COVID doesn't seem to be spread as easily to children, but please correct me if I'm wrong. And what's the latest that you all are hearing? And I'll let any one of you start to answer that question. Or not, doctors.
Sure.
Dr. Hernandez, don't leave me hanging. Thank you, sir.
Sorry, yeah, no problem. So as far as being transmissible to children, I think it is. I think the point that we have been sticking to is that children seem to do much better with the virus than people of an older age, and no particular reason that we know of scientifically why that is. But they do just tend to fare better, so they typically have kind of cold symptoms. But there is a few subsets, and there's no way of knowing who is going to be the ones that are more severely affected, which is why we're worried from our end as well. And we take the virus very seriously and are monitoring our children closely.
Sure. Thank you. Thank you for that. Dr. Young, let me just ask you again, when it comes to children, we still have cases of children being infected with COVID, do we not?
Yeah, so we are seeing, at least here in our community, several kiddos coming in with cold-like symptoms. Usually what kind of tips us off to it is that they have had a known close contact with COVID. So it's kind of interesting that we're seeing more of the adults having symptoms, and then a couple of days or a couple of weeks later, we start seeing our younger kiddos having those symptoms. Thankfully, for the most part, we've had most of our patients do pretty well and have been able to stay out of the hospital. And there's just been a handful of them that have needed closer observation in the hospital.
Very good. Thank you for that. And Meredith, Justice, can you talk a little bit about maybe some of the safety practices that are being followed there at San Juan Health Partners Pediatrics for folks who do need to come in to see any of you?
Absolutely. We're definitely encouraging parents and families to bring their kids in when they're sick and still for their well checks. So we have it split right now. We're only seeing well kids in our main office, and we're seeing the sick kids in a building next door. So they're completely separate to try to keep as many people as we can healthy and still provide the care that the kids still need all their normal primary care needs, their vaccines and all that kind of stuff. So we're still doing all those things.
Very good. And that has been one of the concerns that I've heard too, and kind of a refrain repeatedly from folks at San Juan Regional Medical Center to everybody, young or old, is that even during this pandemic, we shouldn't stop getting our regular health checkups, our regular screenings, and all those things. And so you mentioned vaccines. What are some of the other things that parents need to be aware of with their children, even during this strange time during the pandemic?
We definitely want to make sure we always monitor kids' growth and their development, make sure they're still developing normally. Their mental health is so important, especially in our older kids who are not in school and not seeing their friends as much as they normally are. So we're seeing a lot of challenges with them. And so we are here to help with all those things.
Very good. Thank you. And Dr. Young, let me ask you a little bit about, again, serving rural communities. We know, here in Farmington, we have relatively easy access to medical care, but San Juan Regional Medical Center and San Juan Health Partners Pediatrics reaches out throughout the region. And so to be able to offer services to folks who maybe have to travel, I don't know, an hour and a half to come see a doctor, that is also part of the work that you do, correct?
Yes, so we are definitely still encouraging our families that are a couple hours out to still keep those appointments with us. We do have some capabilities with telemedicine visits as well. We just ask that families call the front desk, and if they are having some of those transportation issues, limited access, to see if we can do some of those video visits. Really the best care, though, for a well child checkup would be in person. That way we can really get a close exam of kiddos, kind of observe kind of those little finite behaviors that you see when you have a kid right in front of you. And then we can also make sure that, of course, they get their updated vaccines, because it's still important to vaccinate against things like tetanus, whooping cough, influenza, among many other things.
True, very true. And I guess it's good, though, to have a choice if folks maybe can't get in face-to-face to be able to maybe put some telehealth together. But as you mentioned, your preference would be maybe seeing them in person. I know it depends on the child, depends on the case, right?
Oh, definitely. And then we do have families that once we've seen in the clinic, there are certain scenarios where it is still appropriate to either be seen in person, or it would be also appropriate to see them via telemedicine, whether it's a secure video chat or a telephone call with that family. And in particular, I know a lot of my partners and myself have been trying to keep in touch with our middle schoolers and teenage patients, especially the ones that we are helping treat with mental health difficulties like anxiety and depression, which are becoming very common, unfortunately, with the pandemic.
Right. Let me ask you a little bit more about that, too. All of you can chime in, too, by the way. But Dr. Young, what is it about some of those mental health concerns? And is there something maybe that parents can be watching for with their kids? I mean, every child I know and every parent and everybody is under probably increased stress these days, and just a little more anxiety than usual, because we have this global pandemic going on. But is there anything you can recommend that parents keep an eye out for with their kids to know if they really need to pay attention to this? Dr. Young, let me start with you.
Sure. Okay. We're all in different rooms, so I can't tell who's talking first.
That's all right.
So yes, some of the common things to kind of look out for in kiddos is sleep. Sleep is a big thing. Appropriate amounts of sleep can help with focus, mood, stability. And so if we're starting to see that our kiddos are either sleepless, having difficulty falling asleep, that can be an early sign of kiddos not coping well. sometimes kiddos can also start having other kind of vague complaints like headaches, not really feeling well, having changes in their appetite. Those are also some signs to kind of look out for. Aside from an acute illness process, those could be signs that, again, kiddos aren't coping well with this scenario. And so some things that families can really try to work on are making a good routine at home, kind of still making it like a Monday through Friday, well-scheduled routine, because kiddos thrive on routines. Teenagers as well. And then also something to consider is planning something fun for Friday night or the weekend to kind of break up that monotony of being at home.
Very good. Thank you. And Dr. Hernandez, is there anything to add to some of those observations?
Absolutely. Yeah, no, I totally agree with Dr. Young. One of the big tip-offs for me is just kind of noticing that things that used to bring joy to the child or your teenager are no longer bringing that same amount of joy as they were before. And that's kind of one of the things that clues me into, okay, maybe we should be keeping a closer eye on this. And yeah, just kind of like trying to create a supportive and normalized environment where the child, whatever age they may be, feels comfortable talking about these issues, because, as you said, this has definitely been hard on everybody, not just adults, but kind of ranging all the way down. So like creating that environment where people can talk openly so that they can get the help and support that they need whenever they do need it.
Very good. True. And Meredith Justice, coming to you, anything to add to this conversation about kind of mental health and making sure kids are mentally well in addition to physically well?
Absolutely. I think physical activity and just getting kids outside for even a little bit every day can be hugely helpful for their mental health, especially the younger ones. So keeping that routine and building in some active time for kids can be really helpful as well.
Good point. Thank you all very, very much. Let me turn a little bit about some of these video visits. And this is, it seems to me relatively newer technology, but had you all been doing some video visits before the pandemic, if necessary, or is this all part of what we learned to deal with in 2020? Who would like to start? Dr. Young, let me go back to you.
So video visits are pretty new, at least in the pediatric world. I'm not quite sure what it has been like in the adult world, but they're not the best exam, but they're better than nothing. So in order to help make sure that our kiddos have access to our services, we do appreciate parents trying to get those scheduled if they're not able to come into the clinic themselves.
Gotcha. Sure. Very good. Dr. Hernandez, video visits, are they growing on you? Are they a useful tool that you have at your disposal?
They definitely are a useful tool. Yeah, it's just a great item to have in the toolbox because this year I think has shown us that we just need to have a diverse method of getting out and reaching out to people to hear how we can best help them. Like Dr. Young said, definitely seeing them in person would be the ideal, but that's not always possible. So I think they do have their utility in the healthcare system.
Very good. And Meredith Justice, let me ask you about the practice, Someone Health Partners Pediatrics. You are all accepting new patients and being able to, with these brand new doctors that you have, being able to see new patients, new families?
Absolutely. We're always accepting new patients. And here lately, we have had a lot of openings. So we can usually get people in within the same day, within the next couple of days, or within the week for sure. So we definitely encourage all families to call if they have any concerns at all with their kids, even if we haven't seen them before. Very
good. And just the address of where we would find you all, I probably should know this, and I don't see it in my notes. I apologize.
We are at 407 South Schwartz Avenue, and we're in Suite 102, which is when you walk in the door, just to the right.
Got it. Very good. And that is, Schwartz is kind of over near the hospital, which is on Maple, but it's all in the kind of that medical campus part of Farmington that has been recently developed over the last several years. So it's all kind of there together, if I'm not mistaken.
Yes, that's correct.
Very good. Thank you. And let me go back to our doctors and talk a little bit about the importance of vaccines. You mentioned that that's one of the things that you all are continuing to do, and I know there's ongoing debate out in the public about vaccines, but I know that every doctor I have on this program talks to me about the benefits of vaccines for children and for adults. We're still in flu season, but doctors, can you give me a plug for vaccines? Dr. Hernandez, can we start with you this time?
Sure, yeah. Vaccines, I think in general are just one of the most remarkable and I think the positive world-changing discoveries that have been made in the past century. And I mean, as you can imagine, we are all 100% fully in support of vaccinations, not just for all the available vaccinations out there. Though they, I know people have a lot of questions, particularly with this newest vaccine that's coming out, given the kind of background of the new methods that they're using to produce that vaccine. But we wouldn't recommend it if we didn't think that they were safe and if we didn't think they would benefit your child.
Right. Thank you. And you're talking about the COVID vaccine, of course, and we know that all the vaccines go through these trials and these tests, even the COVID vaccine, which was developed but record time. But as you say, they are all relatively or all safe, and you recommend them. Dr. Young, your thoughts about vaccines and why parents should be vaccinating their children?
Yes. So, like you mentioned, we have had studies in the past about the efficacy of the vaccines, but we've also, throughout the country with the CDC and the American Academy of Pediatrics, have helped develop our recommended routine vaccination schedule. It's based on the patient's age and also their risk factors for having severe illness if they were to get that infection had they not been vaccinated. So parents always get a little bit nervous when they first come in because the first year of life, we really do require several boosters to cover against things like diphtheria, whooping cough, also pneumococcal disease, which can cause things like brain infections, spine infections in babies, pneumonias, blood infections. And again, thankfully, we don't see a ton of these severe outcomes in the community and generally across the U.S. Because we've been able to really help advance vaccine programs for kiddos and teenagers. So if it's been a while since your kids have had their vaccine, it would be appropriate to call our clinic and ask if they're up to date. Usually the schools are also pretty helpful about helping remind parents to get those updated if needed.
Sure. Good point. And I really like to kind of spend some time or just reminding the audience that, you don't have to go back too far in history to talk about the benefits of vaccines. I think Dr. Hernandez mentioned it. That's one of the greatest innovations, and just the scourge, if you will, of the polio infections back in the even 1950s, I think it was, when the polio vaccine came out, and that really changed a lot of outcomes for a lot of kids. Parents were very concerned about their children catching and developing polio before the polio vaccine. Am I remembering this correctly in my history class?
That sounds absolutely correct. Yeah, I think one of my favorite questions is whenever parents do ask about some of these diseases that we vaccinate against, because that kind of just, for me, really goes to show how well these vaccines work, because, people haven't heard about them in such a long time, that the kind of the diseases that we read about in a textbook now, because they're not really see too much out in the community, which is exactly what we were hoping for whenever we started vaccinating.
That's true. And it's nice to not have to worry about that, at least in my opinion. And so we're seeing, I think, with, I'm not sure of the reasoning, but there was just a story, I believe, in the newspaper not too long ago about the numbers of flu cases seem to be lower this year. And I can imagine it's probably because of some of the precautions we're taking because of COVID. We're being more careful about washing our hands and not touching our face and wearing face masks and all those other precautions. Obviously, maybe the other added benefit is not spreading the flu around like we normally do in the winter. Is that something that you see also, doctors?
It is, and yeah, no, I'm glad to hear you say that, because it's not just the flu; it's essentially all the other viruses that we would normally see being transmitted in the community around this time of year. I think every parent knows that the winter months are definitely cold season, and just being here in the hospital, we are having much less cases than we would normally expect of kids having severe respiratory illnesses because of that, because the viruses aren't getting spread as easily throughout the household.
Which is great. So very, very good. And let me turn to Meredith Justice for just a moment in talking a little bit more about some of the things that families can bring their children in to check on. I know, obviously, when we have active kids in school sports, there's sports physicals and sports screenings and things like that. We always hear about maybe some underlying conditions that maybe aren't apparent until a child is screened or looked at, maybe a heart condition or something like that. These are all things that you all are trained to look for and to discover potentially, correct?
Absolutely, and we really encourage parents to even bring their older kids in for their well checks. Normally, we might be seeing them because they need a sports physical form signed, and since we're not playing sports right now, there's still so many other things we talk about their health in general and their growth, and so many things that are so important. And if parents have any concerns about anything about their kids, we encourage them to call.
Good point. And even older kids with their growth and things like that, there's still things to maybe look at as far as your office is concerned?
Absolutely. We'd like to see kids every single year.
Very good.
And I just wanted to add on to what Meredith was saying too. For older kids, we also like to start talking about how to help manage their health care as they age out of our pediatric practice and start entering into the adult world. So it's also good for kids to come in, teenagers come in with their parents. And then we always like to spend a brief amount of time talking to the teenagers briefly alone, just to kind of talk about maybe more personal questions, but also give them that opportunity to practice taking ownership of their health.
That's a great point, Dr. Young, because I've always heard that young people and young adults seem to feel that they are indestructible, but it's maybe an important thing to have a conversation about their health and what can impact it negatively.
Definitely, and then also just talking a lot about preventing chronic illness, because even chronic illnesses, things like prediabetes, high blood pressure, high cholesterol, those things can start becoming more risky depending on what the kid's health was like when they were younger and even in teenagers. So again, it's a good time to talk with teenagers and talk about healthy lifestyle changes for them to help reduce the risk of getting those types of chronic illnesses.
Sure. And let me end our conversation this morning with all three of you by talking a little bit about some of those things, maybe, and even nutrition, because I mentioned that's part of the conversations that you have, Dr. Young. What do you tell kids, young adults, teenagers about nutrition? Is that part of those conversations that you have?
Most definitely. So basic things, we want to give our body a good routine. Routine, again, is so important for sleep as well as mealtime. So really trying to encourage those 3 regular meals. Our brains need good hydration with plenty of water. We also need carbohydrates. Not all carbohydrates are bad. So our brains do run on carbohydrates. So having a good hearty breakfast is important. And again, having a good proportion of fruits, vegetables in our daily intake, and really trying to cut down on those caffeinated beverages as well as sugar-sweetened beverages, because those actually do put a little bit more stress on the body. They strain our energy. And there's more depth to that, of course. But yes, having those regular meal times, trying to limit our junk foods, because everyone does enjoy them once in a while, but not going overboard. Everything in moderation.
Very good. We could do a whole show on nutrition, I know, with all of you. So, Dr. Hernandez, your advice for kids and teenagers about nutrition, eating healthy?
Sure. Yeah. No. One of the things that I'd love to keep in mind is that the habits that they develop now are likely the habits that they're going to have for, if not the rest of their lives, for at least the first part of their adulthood. So yeah, no, I think it's very important to talk about those things early. Because once they leave the house, they're kind of on their own in terms of making good decisions for themselves. And the earlier we start talking about good eating habits, having portion sizes, being cognizant of what we put into our own bodies, I think just benefits not only the child but also just all the families involved.
Very, very good. And Meredith Justice, I'll give you the last word this morning as far as children's health and nutrition. What do you want to leave us with this morning?
We also want to talk with the whole family about including everyone in these kind of goals for nutrition and healthy lifestyle, like routine, like Dr. Young said, but the parents modeling good, healthy, good portions, lots of variety in their foods can be a huge impact on kids, and then help them develop their kind of their lifestyle as they grow older and grow out of the house. So kind of the whole family working on it together can be hugely beneficial for the kids.
Great advice from all of you this morning. So thank you very much, Meredith Justice, a pediatric nurse practitioner, Dr. Shawna Young, and Dr. David Hernandez from San Juan Health Partners Pediatrics. Thank you